mentioned. So what's going on with the kidneys when you have diabetes and high blood pressure that's causing them to decline?
So we know that, diabetes affects big blood vessels, but it also affects small blood vessels like we see in the kidneys. So within the kidneys, there are lots of millions of little factories called nephrons. And those are all little individual units that actually clean the blood and make urine. And the most important part of that is something called the glomeruli, which basically provides blood flow, that blood can be cleaned and then urine can be produced from it. And so each of those little factories, all those little blood vessels, over time, when people are diabetic and it's not well controlled, what we see is damage to those blood vessels. And so oftentimes in diabetes, the first sign that we're seeing is not kidney function gets worse. What we see is that damage, and how we'll see that clinically is we see protein in the urine, or something called albumin as well. Albumin is just a type of protein. And so what we test for routinely in diabetics is, are we seeing protein or albumin in the urine? Are those early warning signs there that, hey, kidneys are getting affected by diabetes, before we start to see that decline? Because we want to do something early.